Continuing with Objective 3, now we're going to define, pronounce, and spell disease and disorder terms related to the endocrine system. We will start with the ones built from word parts. Acromegaly, enlargement of the extremities. Adrenalitis, inflammation of the adrenal glands. Adrenomegaly, enlargement of one or both of the adrenal glands. Hypercalcemia, excessive calcium in the blood. Hyperglycemia, excessive sugar in the blood. Hyperkalemia, excessive potassium in the blood. Hyperparathyroidism, state of excessive parathyroid gland activity. Hyperpituitarism, state of excessive pituitary gland activity. Hyperthyroidism, state of excessive thyroid gland activity. Hypocalcemia, deficient calcium in the blood. Hypoglycemia, deficient sugar in the blood. Hypokalemia, deficient potassium in the blood. Hyponatremia, deficient sodium in the blood. Hypopituitarism, state of deficient pituitary gland activity. Hypothyroidism, state of deficient thyroid gland activity. Panhypopituitarism, state of total deficient pituitary gland activity. Parathyroidoma, tumor of a parathyroid gland. Thyroiditis, inflammation of the thyroid gland. Again, lots of activities for you to complete, and then diseases and disorders not built from word parts. Addison disease, chronic syndrome resulting from a deficiency in the hormonal secretion of the adrenal cortex. Congenital hypothyroidism, condition caused by congenital absence or atrophy, wasting away of the thyroid gland, resulting in hypothyroidism. Cushing syndrome, group of signs and symptoms attributed to the excessive production of cortisol by the adrenal cortices or cortex. Diabetes insipidus, result of decreased secretion of antidiuretic hormone by the posterior lobe of the pituitary gland. Diabetes mellitus, or mellitus, I've heard it both ways. Chronic disease involving a disorder of carbohydrate metabolism caused by underactivity of the insulin-producing islets of Langerhans and characterized by elevated blood sugar. Gigantism, condition brought about by hypersecretion of growth hormone by the pituitary gland before puberty. Goiter, enlargement of the thyroid gland. Graves' disease, autoimmune disorder by the thyroid gland characterized by the production of more thyroid hormone than the body needs. Ketoacidosis, serious condition resulting from uncontrolled diabetes mellitus in which acid ketones accumulate from fat metabolism in the absence of adequate insulin. Metabolic syndrome, group of signs and symptoms including insulin resistance, obesity characterized by excessive fat around the area of the waist and abdomen, hypertension, hyperglycemia, elevated triglycerides, and low levels of the good cholesterol HDL. Myxedema, condition resulting from an extreme deficiency of the thyroid hormone thyroxine, a severe form of hyperthyroidism in an adult. Pheochromocytoma, tumor of the adrenal medulla which is usually non-malignant and characterized by hypertension, headaches, palpitations, diaphoresis, chest pain, and abdominal pain. Tetany, condition affecting nerves causing muscle spasms as a result of low amounts of calcium in the blood caused by deficiency of the parathyroid hormone. Thyrotoxicosis, condition caused by excessive thyroid hormones. So let's look at a few of the pictures that the slides have. So this is the enlargement of extremities. So again, you can always look back, but that is going to be acromegaly. And then here's a picture of Cushing syndrome. Remember, if you look back, that is a group of signs and symptoms attributed to the excessive production of cortisol by the adrenal cortices. And going on through the definition, this syndrome may be the result of a pituitary tumor that produces ACTH or a primary adrenal cortex hypersecretion. Signs include abnormally pigmented skin, moon face, pads of fat on the chest and abdomen, buffalo hump, which is the fat on the upper back, wasting away of muscle, and hypertension. And then here is a goiter, which is enlargement of the thyroid gland, may be caused by autoimmune disease of the thyroid, such as Graves' disease or Hashimoto thyroiditis. iodine deficiency or the presence of multiple nodules. And that will end this recording.